Hello, everyone. Welcome back to another episode of CRNA School Prep Academy. I'm your host, Jenny Fennell, CRNA. And today you're going to want to save this episode. Today we are going to cover real interview questions. So this will be a great resource for you when it comes time to studying for your interviews. I'm literally just going to go through real actual questions that the students were asked. So you have a nice little study list to go by. Everyone's afraid of their CRNA interview. And I can tell you right now, everyone thinks they did way worse than what they probably did. We are all our own worst critic. And also want to remind you guys, these schools are not looking for perfection. So again, it doesn't exist. Do the best you can, and that's okay. If you don't know something, try to tell them something you do know around the topic versus saying, I don't know. I'm not saying that you should make something up and completely bluntly lie, but again, if you don't know the answer, say, well, I'm not familiar, or I don't know that, but this is what I do know. This is what I can tell you around that topic. Just so they can kind of gauge where you're at with your knowledge base. Because again, if you just say, I don't know, they have nothing to gauge with, so try to give them something to work with. All right, so let's go ahead and get into it. So number one thing that you will be asked in CRNA interviews is about drugs, okay? You're gonna have to know various drugs down to the cellular level, how they react, receptor sites. So by far, most common thing asked in CRNA interviews is know your ICU drugs, know your vasoactive drips, your sedative drugs, ACLS drugs. Again, all know them down to the cellular level and how they work. So again, this person asked, they're asked about drugs and the receptors down to the cellular level. They got asked about stroke volume. Okay, so knowing the formula for that, Frank Starling's law. And then they got asked about SVO2 and how Pulstox works, which I probably even know what program this is, but I'm not going to say because it's definitely a favorite question. But how the Pulstox works, look up something called the Beer-Lambert law. There's a website called How Things Work. Gosh, I know it's on my resource page, How Things Work. And then I'm going to type in anesthesia. Okay, so this website's called howequipmentworks.com. They give a really good description of the Beer-Lambert law. I knew it was something like how something works. So howequipmentworks.com. If you were to visit that site, it does do a really good description on how a Pulstox works and talks about the wavelengths of different light and that type of thing. So check out that website. Also, for those of you guys who are CRNA School Prep Academy students, on our resource page, we have resources for pretty much all of these questions, as well as our learning library covers all of this in detail. So there's no way I have time to cover all of these questions in detail. I'm literally just going to be telling you the questions for you to do your own studying, just for those of you who are not familiar with types of CRNA school questions. All right, another question that was asked is, if I had a warning label, what would it be? That's a unique question and interesting. They also got asked, what is something about me the interview panel might not know? So again, they're kind of digging for a little more information from you than they can get from your resume. And they're just trying to see who you are as a person. So they want something kind of that, again, they wouldn't know otherwise. They wouldn't, don't say, well, I've been a CVICU nurse for 6 years. And prior to nursing, I was a nurse's aide. It's all on your resume. So they want something that they can't find out from the resume. So make sure you're telling them something unique about you. This one person actually was told to take a financial preparedness quiz prior to the interview, which is very interesting. I bet you if that, depending on how that quiz or how that survey shook out, they may ask you about financial preparedness in the interview. This person was asked to describe late versus early signs of sepsis. Tell me about yourself. That's a very common question. So similar to like, what's something about me that the interview panel might not know? So kind of a different way to ask me or ask you, tell me about yourself kind of thing. I've had students ask me, well, should I talk about work-related things as far as tell me about myself and highlight my accomplishments on my resume, or should I make it all personal? And this is really just, that's up to you. There's no right or wrong answer for that. Just make sure if you do make it about work that you really are kind of summarizing and highlighting the main points versus regurgitating your resume. if I had to pick, and again, I can't speak for all the programs, I kind of like personal tell me about yourself, because again, I can get other things from your resume. But if you had some kind of major accomplishment, like a Daisy Award or something like that, I don't know, maybe tell the backstory about the Daisy Award. I don't know, maybe just something like that to highlight on your resume, and maybe something about you that makes you who you are as a person that allowed you to get that award professionally. You know what I mean? So you can still kind of blend personal and work together for that question. If you have considered advanced practice nursing professions, how have you prepared? Or have you considered other advanced practice nurse roles? So that's interesting. So yeah, they might ask you, have you considered becoming an acute care NP or any kind of other acute care NPs, and why? And then maybe even like what brought you back to CRNA? They asked this person again, how have they prepared up to this point for CRNA school? And so this is really important to actually have been actively doing things. This is why I kind of preach all the time that you should be preparing for CRNA school from the time you decide you want to do it, from the time you step in the ICU. It really should be a very long road ahead of you, being part of CRNA School Prep Academy, going to conferences, doing what you can to get involved in the community, and really just understanding and knowing what this profession is all about, shadowing CRNAs. So again, they're looking for how invested are you in your career path to becoming a CRNA? How do you deal with stress? That's a really good question, because you're going to be really stressed out in school. And one of my previous episodes, I talked about mental, or not even mental, but just overall wellness plan, having a wellness plan. You need to have a wellness plan. Okay. You need to know how you're going to deal with your stress. And I really think it starts from having a good habit on doing this, almost to do it daily, to handle your stress daily. If you have good coping mechanisms to handle your daily stress, you're going to be okay in CRNA school. So they're going to pry, they're going to ask you these things. So again, having that plan and knowing how to speak to that plan too. Like, this is what I do to cope with my current stress. This is how I think it's going to help me in CRNA school. This person also got asked, have you prepared financially? So very important too. I think in the last episode we did, I also covered one of the first things you should do when you gain acceptance to school is to, I mean, you should be doing this prior to actually, but one of the first things you should really hone in on is your financial readiness. Once you do gain acceptance, kind of get everything in order, you know. Tell us about a failure in your life and how you overcame it. That's, you know, I think people have a hard time thinking about when they failed. And I know if you're like me, sometimes when something negative happens, it must be a protective mechanism, but like, I kind of black that out. Like I kind of I don't hone in on it. I don't dwell on it, I guess. And so over a period of time, I tend to forget those things, or I don't remember them in great detail. Now, don't get me wrong. I could definitely speak of some bigger failures, but I think it's important to start thinking about that now, so you have the details. Because me, I could probably tell you what I failed at, but could I tell you all the details? Not unless I've really probably dwelled and focused on it. And I don't know if that's a bad thing or good thing. I'm just saying, I know that's how I am. I mean, if something happens to me that's kind of not good, I tend to try not to put too much focus on it. I try to just keep moving forward from it. And so when I'm asked about the details of it later, I'm like, I don't know, but this is how it turned out, and I'm okay now, you know? So, anyhow, just something to think about. I mean, we obviously all learn from our failures, right? That's part of what it is, but remembering the details of the failure and the actionable steps you took to overcome it is what sometimes can get a little muddy over time. Okay. So talk about a conflict where you got criticism from a coworker. Ooh, that's a good one. And has that ever happened? Like, do you even know about it? You know, part of me thinks like, if I had a coworker say something about me, I don't even know if they'd be man enough to tell me to my face, you know? I mean, I'm sure people have said stuff about me behind my back, but have you done something where someone actually has confronted you on it? And remembering that, because same thing, like, I would even have a hard time thinking on the spot what that would be. I remember one time I got mad at a coworker who left out of order, meaning like I was due to leave at 3:30. It was 5:30 at night, and she was at 5:30, and she left at 5:20 p.m. and left me in a room to finish my case. I was really angry about that. And I confronted her, and then we got into this little riff. We're fine now, but I mean, she was mad at me for being mad at her at that, so anyways, and personally, she was in the wrong. So anyhow, I'm still sticking to that story. Anyhow, so yeah, thinking about those things ahead of time will make it much easier to speak to it on the spot, right? Especially when you're nervous. And me personally, I don't know you guys, like I had 2 CRNA interviews. I have a way harder time with personal questions than I do like black and white questions. Cause for me, it's easy to study black and white stuff and be able to kind of like understand it. The personal questions, again, I'd have to put a lot of effort into having a good game plan in my mind on what I would say. So it's really about just being reflective on yourself and your experiences, both in the ICU and personally. So this person also got asked, tell us about your shadowing experience. Again, why I stress documentation, because if your shadow experience was years ago, and now you're in for your CRNA interview and they want you to describe and explain your shadow experience, you're gonna be like, but if you documented your shadow experience and wrote down everything you learned, your takeaways, all that stuff, you can review that prior to your interview. And you can also submit it as documentation, which I think always looks good, even if they don't require it. So even early on, document your shadowing experience. And I think what's kind of cool about documenting every time is you're going to see your growth. You're going to see, oh, wow, when I first shadowed, this was my takeaway. And it was so like maybe laser focused on a couple things. And now that I've done it several times, my takeaways are a much bigger picture takeaway. So I think that'd be kind of cool to see. And you can report that too when they ask you about this question. Well, I've documented every single shadow experience. And these are my big takeaways when I compare my first and my last shadow experience. That would be a really cool way to answer that question. I think that'd be impressive. This person got asked about hemovolemic shock, but down to like the body's compensation, such as the RAS system, which is the renin-angiotensin system. So understanding that, so very, very detailed. This person, again, medications and receptors they acted on. So I already touched on that. Definitely pretty much a given that you're going to be asked about drugs and how they affect. And so ICU drugs, ACLS drugs, sedation drugs, pain medication, those are the really big ones. But they could even ask you about like, Clevoprex, not Clevoprex, clonidine. I mean, it is a sedative drug, but clonidine, I even have heard about like Pepsid and different, histamine blockers being asked about too. So not just vasoactive drugs, understanding, other, just any medications you're giving, you should understand how they work. That's kind of like what it kind of comes down to. It's hard to really say. I mean, there's so much to know, but that's why if you take it day by day, little by little, while you're gaining the 1 to 2 years of ICU experience, it's not going to feel super overwhelming. If you wait till like 2 weeks before the interview and you're like, I have all these drugs to study. Okay, it's going to be super overwhelming and you're probably not going to be able to just know everything that quickly. But over time, if you quiz yourself over time, when you're working in ICU, you're going to see that drug more than once. And so the next time you see it, it'll jog your memory of what you've already studied. You'll study it again because you'll remember it. And so it'll be reinforced over time. And then it's not going to feel super overwhelming to be asked about in the interview. So please take my advice and do that. Tell me about a situation when you had limited facts, but had to make a decision. Ooh, that's a good one. That'd be hard. I see how these would be hard to like think on your toes. Yeah. So I'll read that again. Tell me about a situation when you had limited facts, but had to make a decision. And what's really cool about this question, why I like it, and I guarantee that's why they picked it, is because you will do this all the time in CRNA as a CRNA. And in school. I mean, what if your preceptor leaves the room and you're like, oh, and the surgeon's barking at you and you have to make a decision on how to treat a bucking patient, and so, but you don't know, I guess you're like, do I use propofol? Do I use rock? What happens if I paralyze them and then they're done? Like, I mean, I don't know. I'm just thinking through some things in my mind that I would have thought as a student being kind of scared in that situation. How quickly do you flip them off the vent then? Does that even come to mind to flip them off the vent? Yeah, just all kinds of stuff. Or, again, when you have to make that critical decision in a split second on how to treat those vital signs, what drug do you need and how do you dose it really quick? How easy is it for you to come to that conclusion? And do you feel confident enough to do it? So anyhow, and trust me, You will, because if it means the patient not doing well and you fall back on your knowledge, you have the knowledge, you have it. And so just know that you do have that knowledge, and your training will get you there. So don't be too scared about it. It'll happen. So yeah, just think about that, especially in the ICU when you had a situation that you were unsure of and you had limited information, but you had to make a choice. What was that and how did you handle it? If you haven't practiced the STAR method, please do. Okay, the STAR method is situation, task, action, result. Okay, so that will, because I've had students who I do mock interviews with who, and I also want to clarify, I don't do a lot of mock interviews anymore. I have a whole team of people who help me do mock interviews now. I'm one person. It's just hard for me to do one-on-one work right now. Anyhow, so back to that, because I get asked quite frequently, hey, can I do a mock interview with you? And I'm like, no, I don't do them like I used to. Anyhow, but they would tell me these scenarios and they would leave out, like they maybe would start with the beginning. They would leave out kind of like the meat of it, or they would leave out details that will allow me to understand the main problem at hand. You know what I mean? The other area that people would commonly leave out was the ending. I mean, I'm like, you left me cliffhanging. Like, I need to know, like, what did you do? What's the result? How did this turn out? Like, you need to let me know the ending. And so they would tell me what happened, but they wouldn't tell me how it resolved. And so that's one of the common things people kind of forget about especially when you're stressed. So kind of just being a good storyteller. You want to give people a little bit of like situation, maybe like some backstory, just a little bit, enough to like, so they have some understanding and context, then take them into what happened, meaning like what actions did you have to take, the details around that, or the situation, the details around that, and then the action that you took. So sorry, yeah. So a situation, action, or situation, task, action, result. Sorry, I'm totally getting you guys confused here. But again, kind of giving the details and understanding along with maybe some tasks related around that, and then the action you took along with the results. So practice the STAR method. You can Google STAR method and find probably more information on it, on how to use it to tell a story. Let's see. If your managers were present here, what would they say your weaknesses are? So knowing your weaknesses. I think a really great way to know your weaknesses is to take a 16 personalities quiz. It's free. It's 16personalities.com. It's a very, very well-known website, and it's really kind of creepy accurate. I suggest that don't pick neutral. Either err on the side of no or yay or nay. If you pick neutral, it's going to not be as accurate. But yeah, 16personalities.com will literally tell you your strengths and your weaknesses, and it will be creepy accurate. So I encourage you to take that and then kind of hone in on that for your interview. I also encourage you, if like your weaknesses, for example, don't just say you have a weakness and it is what it is. How are you working on that weakness? What are you doing to improve that weakness? Is that something you recognize and so you're aware of it? So you're making active steps towards being better. I mean, they do want to see that. They don't want to say, okay, your weakness is this, and you're just like, okay, cool, I'm out. That's just my weakness and is what it is. Because we're all human. We're all going to have weaknesses all the time. We're never not going to have a weakness. That's to be understood. But we should always be aware of our weaknesses and try to work towards not having these weaknesses, right? Doesn't mean we're not going to have them, but if we're recognizing them and aware of them, they won't hinder us in life as much as they otherwise would. So that's all. What would you do if you heard one of your coworkers make a racist remark? That's a really good one, and one that definitely I would think would catch you off guard if you weren't hadn't prepared for something like this. So think about it. Has that happened on your unit, and were you actively involved? Or even if it wasn't you, if there was a situation that happened, how it unfolded, and if it were to happen to you, how would you have handled it yourself? So definitely something to think about. Tell us something unique we can't find from your application materials. So this is a very similar question to the other one that was mentioned above. What sets you apart? That could also be similar to tell me about yourself. They're looking for something unique, but what sets you apart could be why should we pick you versus anyone else? What makes you a good candidate? What makes you a unique person, or a likable person, or someone that we would want to get to know? Why would we want to get to know you? What is it about you that, again, what is your strength? What sets you apart, right? So other ways to look at that question and kind of interpret it to get to your answer. How stressful was the interview? So this interview style had one of 5 interviews. So they room to room to room. And they asked this person what the most stressful interview was so far. And probably one of the last interviews, they got asked what the most stressful interview was and why. Why our program, which, oh man, especially for those of you who have like multiple schools you're applying to, I can't stress this enough that you have to remain organized. You have to be very clear on your whys for individual programs, not just because I want to get into school. Like you're going to throw your application in everywhere and I don't care who you are, just take me. Like they don't want that. They don't want to hear that. And don't tell them that. Really have, because also it's really true though. You really need to want the school as much as they want you, because you're spending a lot of time and money. You want to make sure you're not making a mistake. And let's just face it, not all schools are meant for you and not all, you're not meant for all the schools. And so it's really both people are choosing in this process. So choose. Don't just say you want to go anywhere. Have a reason why you want to go to this program. Research their mission. What are they passionate about? What's their mission statement? Understand that. What are some bragging points that they've mentioned in their open houses that you have attended? Because I always preach you should attend those. So knowing the program in and out is really important because they may ask you, and it's not going to impress them when you don't know about their program. They're going to think, oh, well, she doesn't want it that bad. I mean, that's what I would think. How did you study for your certification Nclex? That's interesting. So this question, they're digging into your study techniques. Do you have good study techniques? This is a common area of weakness a lot of students experience during anesthesia school. So they are evaluating for that right now in the interview. A lot of students can coast by and get good grades in undergrad and getting their BSN. In anesthesia school, it's a whole different ballgame because of the amount of material that you have to learn at once. You have to have not only good study techniques, but efficient study techniques, which is easier said than done. If you haven't listened to my study technique episode, please do that now. I believe it was episode 38, but don't quote me on that. It wasn't too long ago. All right. So nursing intervention for a patient with a pneumo and resident fellow staff were not around. That's a good one. What would you do for a pneumo intervention? And again, you would probably, the way I would start this question is understanding the physiology behind it. And then so I would tell that to them out loud. Okay. And then you would kind of then talk about what you do, and, for me, I would want to make sure, like if you're experiencing a pneumo, you want to make sure, I always think of like, you want to make sure they're tanked up because they're going to have increased pressure. So decrease SVR. Yeah. So again, I would start with the physiology process of what a pneumo is and then how you would treat it. That's what I would do. What is Ards? Well, that's a loaded question. So going into the at-hole, Ards but understanding like the zones of your lung, also maybe even why proning can help, that would be a really cool way to answer that question. But what vent settings would you use with Ards? Another good one. And I think we all know that, people with Ards are on high PEEP, but we also understand how can PEEP be bad? I would challenge you to know that, how PEEP can be bad. Or what are some of the consequences, sequelae of a high PEEP? But again, what vent settings? Would you use high tidal volumes? Most of us know that you wouldn't, but why? Do you know why? So I challenge you to know that. What is tidal volume and how is minute ventilation calculated? Ooh, that's a good one too. Why is lower tidal volume used with Ards? Oh, well, okay. So I challenge you to look that one up. Name a drug that is an alpha-2 agonist. And I guess just backing up a little bit to the tidal volume with Ards, a lot of it has to do with, obviously your lungs are filled with fluid, your alveoli are obviously succumbing to a lot of damage, and you have elasticity in your alveoli sacs, but they're full of pus and grossness. Okay. So there's something called barotrauma, and it's much easier done when you already have like an Ards picture going on with your lungs. So you can actually worsen your ability to ventilate with high tidal volumes. Anyhow, look it up. It's way more complex than that, but I just want to give you a broad overview. Name a drug that is an alpha-2 agonist How does NEO cause bradycardia? That's a good one too. What vent setting changes would you make with a patient who is acidotic? So a lot of interviews will ask you about ABG interpretation. Definitely, we have a whole ABG workshop inside CRNA School Prep Academy. And as far as like alpha-2 agonists and NEO, we have an entire pharmacology lecture, 2 of them actually. We have 2 pharmacology lectures inside CRNA School Prep Academy that goes over all of that. So yeah, so again, knowing these are back to the knowing your drugs and receptors and how they work, okay? Tell us about a time you harmed a coworker. Ooh, yikes, really? I mean, I don't know if I'd be able to answer this, like harmed a coworker. Now, the way I'd probably have to start thinking about this for myself is, okay, harm physical or harm emotionally? I don't know if I've ever physically, maybe I've stepped on someone's foot, but I don't think I've physically harmed a coworker. I've definitely had a coworker spray poop in my face by accident. That's kind of harming me, right? So I mean, maybe you've sprayed poop in someone's face by accident. But probably more emotionally, you know what I mean? I think we don't realize sometimes when we do things that are insensitive, especially if we're under stress or pressure. Like, let's just say if we're in a code, for example, and you bark an order or you shot someone down if they gave a suggestion, you know what I mean? Maybe it didn't come across in the nicest way. Maybe they took that like really personally. So that could be harming a coworker because now maybe they feel shy or embarrassed or whatever it is. I mean, you know, so that's kind of how I would start interpreting that question to make it easier for me to answer. Because I'm sure we can all reflect on the fact that maybe we were not the best communicators at one point, and we may have said something that hurt someone else's feelings, right? If you went to a conference, they just asked if you went to a conference, if you've been involved in any kind of conferences before, nursing or CRNA conferences, or like, you know, so they have like, I mean, there's a lot of different ways you get involved. A way that people don't actually think of a lot is through like your local state associations. We all have our anesthesia associations, not all the time, but sometimes they do events where they do allow RNs to join. So definitely take advantage of that. California, for example, had what do they call those? What do they call the SRNAs? They call them student nurse anesthesia residents. Anyhow, they had an event where it was free to attend, and it was mostly for current students. However, RNs could join. Obviously, I'll keep an eye out if they do something like that again this upcoming year. I will post about it as well. But there's always opportunities. You just kind of have to look for them. If you're not a part of our ICU Dreaming About Anesthesia Facebook group, that's a great place to learn about opportunities. So join ICU Dreaming About Anesthesia right now. Stop this podcast, pause it, and join the group because, again, I post things like this when I find them. Oh gosh, what? This next question says, you got intoxicated and posted photos everywhere. What would you do? Oh, well, they might have had a student who did that. So now, I mean, I don't know. What I have to say about this question though, you guys, is, social media. It could be great, but it can also be not so great. And you have to be so careful as a current student. I mean, it's really not a time to like blow up your social media following. I mean, personally, don't think so, because you got to be so careful. Like, I mean, don't get me wrong. I know people want to share their experience, and I think that's great that people are sharing their experience, but be so careful about what you post. The faculty are watching, okay? And they will hear. Word of mouth circulates like crazy. I mean, you know, word of mouth gets around. So if you post something that's inappropriate of any kind, even if it's like provocative or scandalous, I don't know. But gosh, a lot of times you really got to be careful too about hospital pictures. Oh my gosh, be so careful. You gotta, I mean, HIPAA they don't mess around. So be so careful. People are so lax about that these days. Every time I see that, it makes me cringe because it takes one mistake to get in trouble. Okay. So be so careful. Turn your badge around. Just make sure you don't have anything that identifies patient stuff in the background. Just be so careful. It doesn't take much to make a mistake. That's why I encourage just not even to do it. But anyhow, so that's my little mama spiel for today. But yeah, no intoxicated pictures. But again, they're asking, what would you do if you did that? Like if you had a girls' night and you're like, woo, and you just got crazy with TikTok, and next thing you know, like it's like your program faculty has seen it and it's embarrassing, what would you do? This question is, what do you need from your faculty? That's interesting. So they're asking you, what do you need from us? What do you feel like you would need as a student from us? If someone was inappropriately touching you at clinical site, what would you do? Ooh, that's an interesting question. It's very, like, it makes you uncomfortable even hearing the question, right? But interesting nonetheless. So yeah, tell us about the article you most recently read. I always recommend students to read the most current ANA journal and just pick one article. It's online publication. I post the most updated version inside CRNA School Prep Academy. Okay, some months I get behind, but you still have like at least a month or two's version of the ANA journal to read, and pick out one article that you really like. And so if they ask you, well, actually, I got a hold of the ANA journal, and this is an article that I really enjoyed out of this, this publication, and this is why. Cool. Like that'd be really, I think that'd be really cool to know, or, or maybe it could be even like, the High Five Habit or the Inside Out, and explain to them why you like that book, because it really helps you with your wellness plan to handle stress in school. That's also a good thing to bring up. So yeah, definitely that, I mean, this says article, but I mean, I don't know, maybe they would take a book, but yeah, article, I would recommend trying to get a hold of the most recent ANA journal. What makes you different from all other applicants? This is kind of like the same thing as what sets you apart. Why should we pick you? Why are you a good fit for our program? If there's one spot left and we had to pick you and want someone else, why should we pick you? That's essentially what they're asking. So again, this is kind of like going back to your strengths and how you've already displayed these strengths in your work environment, how you currently, some of the things that you're proud of, like if you've had an accomplishment, or maybe their class sizes are really small and you work really well in small classroom sizes. Maybe you taught in an undergrad setting and you ran study sessions for your nursing school class, or I don't know. I mean, I'm just trying to think of things like you'd want to make it relatable in the sense that you've already, like, you can speak to it as far as why you have these qualities, and this is why, and this is how you've implemented them in the past, and this is how you plan to bring them to their program. Okay. I've had students say things like, again, the fact that they work well with other students, they enjoy, being mentors to others, their classmates, they enjoy the small classroom sizes, and this is why, whatever it is, they find reasons that they feel like they would be really good students for their program. So yeah, I hope you guys enjoyed. I know this episode got kind of long. It was a lot to cover. Obviously I couldn't cover all of the physiology stuff, but I encourage you to utilize the learning library inside CRNA School Prep Academy to learn these things. Otherwise, hit the books, or there's tons of great resources on YouTube. I have an ultimate resource guide that gives a lot of great resources for you that are free, like on YouTube, that you can go and brush up on all of these things. So I hope you guys enjoyed this episode, and make sure you save it. And thank you. I appreciate if you leave me a review, give me a thumbs up, follow me, whatever it is, wherever you're listening to this. Thank you. And we'll see you next week. All right. Bye-bye.